Adequate sleep is important for all humans regardless of their age. All newborns are expected to have enough sleep in order for them to grow and develop as expected. A full-term newborn baby may sleep for up to 17 hours in a clock of 24 hours, while a premature baby may go for 22 hours of sleep in 24 hours. Of course, this sleep will be interrupted with wake to feed times, and the smaller the baby, the more frequent they'll wake up to feed. Breastfed babies tend to wake up more as compared to formula-fed babies, and the reason is formula milk tends to take longer to digest as compared to breast milk. As a parent, it's very, very important to know the sleep cues of your baby and also have a consistent routine that you're going to put your baby to sleep. So the routine could be anything from you breastfeeding the baby just before they sleep, or giving the baby a warm bath and then a massage after that, then they go to sleep. Or it could be something like reading a book or singing lullabies. Whatever it is, make sure that you do it as a routine. The other thing that you need to really remember when you're putting your baby to sleep, make sure the room is dark or at least dimmer than when the baby is awake. The other thing that you must always remember is make sure that you put your baby to sleep on the same place every single time. Whatever you do, make sure there is consistency. As we put our babies to sleep, we know there's usually that risk of having sudden infant death while they're asleep. So what things can we do so that we are able to reduce the chances of sudden infant death? The first thing is the position we put our babies to sleep. I know there's been a lot of discussion on which is the best and safest position to put your baby to sleep, but I do recommend that you put your baby to sleep on their back, not on the side and not on the tummy. Some mothers will argue that if I put my baby to sleep on the side or on the tummy, they tend to sleep better and longer as compared to when they put their babies to sleep on their back. The reason we do recommend is when you put your baby to sleep on their back, the trachea, which is now the windpipe, lies on top of the esophagus, which is now the food pipe. We know that babies do have reflux, especially when they are young. And this reflux can actually happen when they are asleep. So if you've put your baby to sleep on their back, automatically the chances of aspiration, that means this milk going into the air pipe, the windpipe, is very minimal as compared to when your baby is sleeping on their side, or worse, when they are sleeping on their tummy. If you're putting your baby to sleep on their tummy, what that means is the esophagus, that means the food pipe, is on top of the windpipe, the trachea. In case of any reflux, chances of aspirations are very high. And if this baby was asleep, they're more likely to suffocate in their sleep and never wake up again. If you put your baby to sleep on their side, because that's what most parents will say, the chances of this baby actually turning and then you finding them sleeping on their tummy are very high. And that means it poses the same risk as someone who's sleeping on their tummy. So if you have a newborn baby, please put your baby to sleep on their back. When they get to the age that they are able to turn either to the left or to the right, that is okay, and let them turn to sleep in whatever position they will desire. The second thing that you need to put in mind is the surface. Where do you put your baby to sleep? We discourage you putting the baby to sleep on a sofa or anything that is soft, anything that will take the baby's shape. And then the other thing is the beddings. Try to keep the place where the baby is sleeping as clear as possible. Any soft toys or any loose beddings are discouraged on the baby's sleep area. What we do recommend is, if you must cover your baby, we usually recommend you cover your baby from the umbilicus going downwards and not the upper part of the body. And the reason is, we do not want this baby to cover themselves with these blankets or any other type of beddings that you use to cover your baby. That may suffocate them. And whatever these beddings are, make sure they are tucked under the mattress loosely, but tight enough in such a way that the baby will not be able to pull it upwards to an extent that they'll be able to cover themselves on the face. Then the third thing that you need to remember is, avoid overdressing your baby. Yes. You see, when you're going to sleep, you need something that is loose and not too heavy. Sweating while you are sleeping is very, very uncomfortable to an adult as well as to a newborn. So whatever you're using as pajamas, make sure the material is cotton and it's able to absorb any sweat. Avoid these sweaters and vests and all these things that usually parents put on their children for the fear of pneumonia. And by the way, you don't prevent pneumonia by overdressing your baby. And the room has to be warm enough. And we say a room is warm enough if you as an adult are able to sleep comfortably. I really hope this is helpful to you. It is always a pleasure. Thank you so much for watching this.